Welcome back to Becoming Superhuman. I'm your host, Dr. Nirvani, and this is the podcast where we talk about using science to elevate your mind, body, and soul. Today, we're reviewing what is, in my opinion, a powerful book that does a good job of bridging Eastern wisdom with Western medicine and dentistry. It's called Accidental Blowup in Medicine, Battle Plan for Your Life, written by Dr. Simon Yu, who is a traditionally trained MD and former U.S. Army Reserve Colonel. And in his time practicing medicine, he realized that oftentimes his patients or people who were coming to him from other providers had not gotten better over a long period of time because the real root cause of their disease hadn't been addressed. And he also realized that root cause was often linked to the mouth or was being exacerbated by problems in the mouth. And so he wrote this book to highlight those issues. And as a dentist, it is always exciting to hear from other doctors who understand and work with the fact that the mouth is intimately connected to the rest of our body. So we're going to dive into 5 key takeaways I had that I thought would be worth sharing while reading this book. The first is hidden dental infections may be sabotaging your health. Dr. Yu in this book emphasizes that many patients with unresolved chronic conditions have undetected dental infections that are silently interrupting with their immune system and their ability to heal. One of the patients that he talks about in the book, for example, had a neurological condition for years and had been assessed by and referred to and worked with a number of conventionally trained Western doctors over the years, had gone through numerous diagnostic tests, and had never really been diagnosed with anything concrete or been treated for anything to really relieve her symptoms. And after seeing Dr. Yu and having him be able to identify and address an infected root canal tooth in her mouth, her symptoms began to subside and she started to see a shift positively in her health. He uses a diagnostic approach that many Western-trained physicians would never even consider. And one of the things that he does quite consistently is evaluates the meridian systems of his patients. In Eastern medicine, each tooth corresponds to an organ or an organ system via the meridians. And these are essentially electromagnetic fields in the body. And this is a very oversimplified way of describing them because in traditional Chinese medicine, these channels are actually pathways for qi or life force, which is a really profound, beautiful way to describe the flow of energy. But just to allow us to wrap our heads around the fact that these channels of energy are real and they can be measured, there is an electromagnetic frequency and quality to these meridian channels. And EMF reading is widely understood within science and medicine to be a valuable diagnostic tool. And this is what's done to read the health of the heart, as an example, through ECGs, or read what's going on within the brain and the electromagnetic frequencies happening within a brain through EEG. So, in the case of how your dental health could relate to other parts of your body, as an example, through these channels, in the meridian system and in TCM, for example, your wisdom tooth could be related to an issue in your heart. And using the acupuncture meridian assessment technique that Dr. Yu talks about in this book quite a bit, rather than waiting for something like a heart attack to tell you you've got an issue in your heart, it's finding an energetic blockage so that you can deal with the blockage, you can treat it, and you never have to develop a heart issue or persist with heart issues that lead to something like a heart attack. So we're going to dive a little bit deeper into the AMA or acupuncture meridian assessment technique, and that is takeaway point number 2. So as I mentioned, this book talks a lot about the diagnostic utility of AMA or acupuncture meridian assessment. So I'm going to call this AMA going forward. And this is a tool that detects energy imbalances within the body by measuring electrical conductivity through different acupuncture points all over the body. This isn't abstract. It is very much based in biophysics and energy medicine, as I just discussed. But it's essentially a way to measure energy flow through the body and through organs. And studies show that it's not woo-woo and the utility of this is reproducible. And low meridian readings can signal that there is perhaps an infection or a toxicity buildup within the body. And this includes infectious diseases or toxicity related to the mouth and related to possible dental work. There was an article done back in 2021 that I will link to. And researchers explored how TCM and traditional Chinese medicine diagnostics like pulse and tongue could be standardized so that they showed more utility in Western settings or in Western medicine. And in developing the article and producing some of the results of the study, they were also able to show that diagnostics that used measurable meridian assessment often supported treatment plans for patients that were much more successful and produced positive health outcomes than treatment plans that relied solely on patient reports of their symptoms and conventional tests that are done. So this was an interesting study because it showed the value of using something like AMA and assessing meridians within the body to treat patients and to lead to health. So as I said, if a meridian reads low using AMA, it can indicate inflammation, toxicity, or an infection. And sometimes this leads to areas in the mouth and hidden infections that could be corresponding to different teeth that are affecting other organs within the body. And this is why this meridian assessment technique is so effective at sort of painting a bigger picture of whole health for people. Because we're not only using a snapshot in time lab test to determine if something is wrong, but we're using the idea that one part of the body is linked to another and treating the body as something that is holistic and has a complexity about it and is nuanced as far as what needs to be done for each individual person to help bring them to a state of health. Now, the third takeaway I got from the book was its emphasis on addressing things like parasites, mold, and heavy metals, and how often these things are overlooked when trying to treat patients or when looking at somebody to assess what's going on in their overall health picture. Now, dental infections or energy imbalances due to metals or dental work in the mouth can put the body into survival mode. And many patients who have failed conventional medical treatment have systemic toxicity, things like parasites, mold, or heavy metals. And he shares an example of a patient with chronic fatigue, chronic brain fog, who had a history of multiple amalgam fillings and mold exposure from a previous living situation. And using AMA, he was able to identify that disruptions in their spleen and kidneys through the shift or the low energy readings in these meridians showed that these areas weren't working well. So after treating parasitic infections and removing the metal or mercury fillings in their mouth, the effect of that was that this patient's energy levels returned, her cognitive clarity improved, general brain fog went away, and overall, she just started to feel better and feel more like herself. So this triad, if you will, of parasites, mold, and heavy metal toxicity, these stressors are rarely screened for in conventional medical settings, but when considered as possible stressors on your system, and then combined with the use of something measurable like AMA, you can actually really effectively treat infections or toxicity that are leading to more chronic conditions. And in this book, Dr. Yu talks about his homeopathic background and how he was originally treating some of these really persistent, long-standing parasitic infections using homeopathically derived therapies. And he was not having a whole lot of success treating these parasitic infections with homeopathy, and he admits that in the book. And he talks about being on a mission overseas and seeing the success of pharmaceutical anti-parasitic drugs being utilized in really harsh, war-torn environments, and seeing that these were actually effective and useful modalities to treat infections. And through that, he started to incorporate some of these pharmaceutically derived antiparasitics in his treatment plans when treating patients. And he was seeing dramatic effects to the point where he really started to shift his way of practicing and way of thinking around these things because they were so much more effective in this specific case when dealing with parasites than the homeopathic preparations were. So I thought this was really interesting because as a prescriber myself, I often question, is there a better, more holistic alternative to the pharmaceutical option that may be readily available? And oftentimes there is. But in the West, we are over-expecting in general and over-prescribing, if you're a prescriber, for pretty much every condition at this point. So the idea that we can start switching our perspective or turning to more natural solutions is appealing to me because we've kind of swung the pendulum so far over to the case where most people are on some kind of pharmaceutical medication. And for me, hearing the story of his success with pharmaceuticals for this particular case, it actually really shifted my perspective on pharmaceuticals and having a bit more respect and honor for them when they're being used intentionally and purposefully. And I think that's kind of the key around these things is that there is utility to pharmaceutically derived medications, but it's typically to treat something to get you to a place of health, kind of get you over the hump of a very deep-seated, persistent infection. And in this case, he talks a lot about these parasitic infections that often go untreated for years because they're really difficult to find and treat. And this doesn't look like prescribing somebody a pill that they have to be on every single day for the rest of their life. And I think that for me was just a really interesting distinction and highlighted some of the respect and honor that we should show pharmaceuticals when it's appropriate to do so. So takeaway number 4, dental decisions must align with your whole body health. And you cannot talk about long-term health without including dental health and possibly dental work into the equation of that. And things like improperly done dental therapies or improperly treated surgical sites or chronic stress response through materials or a shift in your bite or just other ways that dental work can actually influence your mouth and then downstream your whole health is important. And one of the biggest takeaways I had from this book is that it's important to seek dental care that aligns with your overall values for your health. So if you believe in detox and regeneration and holistic medicine and holistic health, your dental choices should also reflect that. And ideally, if you can find a dental health provider who holds similar values, that puts you in alignment as far as the things that you're going to experience from a dental health perspective. Takeaway number 5, be strategic about how you treat your body. Borrowing from his military background, Dr. Yu teaches that healing is not random. It's incredibly specific and systematic. And he advocates and teaches and practices the value of treating imbalances and disease in a very specific order. So typically, what I gathered from reading the case studies in the book is that he will usually stabilize dental infections, and sometimes that involves recommending certain dental treatments. He will identify energetic imbalances using the AMA technique and then attempt to clear those imbalances up. He will clear parasitic infections and other potentially toxicants such as heavy metals, and support organ health and organ system function. And really, this is more than simply integrative health. It's recognizing that there is a personalized and tactical approach to addressing energetic imbalances and achieving health in each and every person. And really, there's no isolating the mouth from the rest of the body or the energetic components that lead to health and disease from the physical body. So Dr. Yu's Accidental Blowup in Medicine is a call for us to re-examine what we think we know about how disease works, especially chronic and complex illness. And I would say that this is especially true for practitioners. If you're a health professional, I would suggest reading the book. If you're a patient with lingering symptoms, read it. And if you're somebody who senses that your dental health may be a missing piece in the puzzle of your overall health and well-being, definitely read it. If this episode opened up a new perspective for you or helped you connect the dots with your own health, please like and subscribe to the Becoming Superhuman channel and share this episode with someone who may need to hear this whole health message. Thank you for listening today. Until next time, where we continue to bridge the gap between science and spirituality so you can continue to become superhuman.